Well, certainly in the past or at the beginning of implantology, everybody was concerned about the functionality of the implants. But once we have tested the functionality, now our bar has raised, our expectations are raised, and therefore aesthetics has come into play. And aesthetics nowadays is definitely maybe the most important criteria to judge whether a restoration supported with an implant can be considered successful or not. First of all, the analysis of the edentulous site or of the site that will become edentulous is so important, and also trying to fine-tune, try to develop and master all those techniques, surgical techniques that can enhance the soft tissues. Without proper pink aesthetics, you cannot have a good white aesthetics. So my work as a prosthodontist really does depend very much, first of all, by the competence of the surgeon in setting up the stage, and secondly, also by the correct management of the soft tissues during all the procedures from impression to delivery. This means that also dental technicians have to become competent, understand how the soft tissues behave, and therefore what they can do and what they cannot do as far as development of the correct profile of the restoration. So there are many different ways to do things, many different techniques. We have to master them. We have to understand the implications of one versus the other. And there is so much out there to be learned, especially by clinicians like these who have a lot of experience and have made a lot of mistakes. So if they are willing to speak about their mistakes, then there is a possibility to really bring home a good message. Anything we do in clinic, of course, has a certain percentage of risk on one side and complications on the others. For example, here in implant prosthetics, we're dealing also with materials, with artificial materials. We're talking about fatigue fractures, possibility of fatigue fractures, possibilities of material failures of all sorts and types. So in my opinion, any clinician who has to deal with implant prosthodontics and implantology in general has to have a good understanding of biomechanics. So biomechanical concepts are very important to know, both for the surgeon, because they will guide him in understanding how many implants, what size, in what distribution within that particular arch. And for the prosthodontist, because prosthodontists have to develop crowns and bridges supported by these implants that will effectively manage the occlusal forces. So if you do not have understanding of the biomechanical concepts that should go behind any project, any prosthetic project, then you're bound to have a higher chance of failures linked to the failures of the materials, of the screws that can unscrew or fracture, of the veneering material of the crowns. Therefore, all of that is very, very important as a basis.